Hi, my name's Paul. I'm the nurse today. How are you?
Good, how are you?
I'm just using my hand sanitizer in my hands. My stethoscope's already clean.
Okay.
What brings you in here today?
I have a sore throat.
Sore throat? Okay. What were the symptoms besides sore throat?
I have a little bit of a cough and a runny nose.
Cough and a runny nose? Okay. Can you state your name and date of birth, please?
Skylar Olivia Sustak, May 27, 2003.
27, 2003. What's today?
July.
What's today? What day? Like of the week? Monday,
Oh.
Tuesday?
Thursday?
It's Friday, but oh boy, what did you work today?
Yeah.
Okay, a little tired from the work. Okay, the patient is alert and oriented, times 3. All right, so I'm gonna start with your eyes. You wear glasses or contacts?
I have contacts in right
You
now.
have contacts in right now. And what current medication are you on?
I'm on Depo-Provera and
Yep.
I take acne medication in a gel form.
Gel form. I also noticed you have Crohn's disease. Do you take anything for that as well?
I get Remicade every 6 weeks
6 weeks where?
at CHOP in
Okay.
Philly.
And that's through the eye vape?
Yeah.
Okay. And you said you wear contacts, correct?
Yeah.
Are they in right now?
Yep.
Okay. I have a Snellen eye chart for you. I just
Okay.
need you to read off the letters. It checks near and far. It's going to check cranial nerve 2. You're going to stand about roughly 20 feet apart. You're going to look at the chart and read the lowest line possible and cover each eye. Then you're going to read from both.
Okay. E F P
Read the lowest line you can read.
F E L O P Z D.
Good. Patient wears corrective glassware. Her contacts are in. Now I'm going to perform a confrontation test. I'm going to test your visual field. It's going to be a peripheral field.
Okay.
And basically, the wider the visual field with the stimuli. So hold the hand up. You're going to hold your hand, cover your left eye, right? Cover your left eye, and you're going to look at the opposite eye across from me, and tell me what you see. How many fingers? Don't move your eye.
1, 2, 2, 3, 4, 2,
Don't move your eye.
1.
Do the other one. And then look at this side. Okay. Oh, sorry.
1, 2, 1, 2, 3, 3,
Don't keep your eyes still. Don't move your eye.
4, 4,
Move your eye.
3, 2, 2.
Okay, her peripheral field is good. Now I'm going to check your papillary and corneal light reflex.
Okay.
You're going to stare out in the distance. I'm going to check the patient's ocular alignment, looking for uneven gaze, 2 feet at midpoint, medial upper aspect of pupil, and make sure there's no asymmetry. The size of the pupil should be between 3 to 5 millimeters. The shape should be round. There should be a direct response, which would be constriction, and consensual response, which is opposite sides constrict together. So I have my pen light. I'm just going to type measurements on here, so I'm just checking. You guys open, please. All right, you have about 5 millimeters pupil size. Now I'm going to shine it one light. Okay. Good. The patient's eyes are the pupil size is 5 millimeters. The shape is round. There's a direct response of constriction when the light is shined, and the opposite side constriction as well when they're together. Now I'm going to check your accommodation reflex. You're going to be fixated on something slowly moving towards your face, which will be my finger. And what should happen is your eyes should constrict as they move closer. I'm going to turn about 2 feet apart. The pupil should be equal, round, and reactive to light with accommodation. So I'd actually use my pen light. So hold your eyes still. Good. Reaction was normal. I'm going to do a position of gaze test. This tells us how well your extraocular eye muscles are working. It's going to be your cranial nerves 3, 4, and 6. It's going to be your superior rectus, which is your upward movement, your superior oblique, which is going to be your downward and outward movement, your medial rectus, which is going to be your inward movement, inferior rectus, which is going to be your downward movement, inferior oblique, which is going to be your upward and outward movement, and the lateral rectus, which is going to be your outward movement, and then move the eye, the left upper, eye left lower, eye right lower, left right. There should be a smooth motion of eye with no nystagmus. So I'm just up, down, over, down, over, center. Good. I'm gonna do the whisper voice test. It's gonna be a number and letter sequence. I'm gonna have you cover the ear not being tested, and you're gonna move the tragus in a circular motion, which is this part of the ear, to cover the ear that's not. And I'm going to stand behind you, and I'm going to whisper, and then just repeat after me.
1, 2, 3, 4, 5.
Just repeat the numbers I'm saying, please.
I thought you said that. 1, 2, 3. HLC.
Cover the other ear, please. Do the same thing.
5, 6, 7. BQR.
Try again.
XYZ.
Patient's hearing is normal. Alright, I'm going to check your sinus transillumination. So I'm checking your sinuses. I'm going to be checking your frontal sinus. And then I'm also going to be checking your maxillary sinus, which is going to be in your mouth. I'm going to hold the light right above your eye. Good. Now open up your mouth, please. Go, ah. Good. No redden. Seems like you might just have a cold, possibly. I don't see anything of strep, but we can get the strep test.
Okay.
Are you any fever, chills, anything like that? Yeah, because your temperature came in. Was any time did you have chills?
No.
Do you have allergies, seasonal allergies?
Yeah.
Do you use any kind of Flonase, like any nasal spray?
No.
Okay. I'd recommend the doctor for that. I'm going to check it's a test called bronchophonia. It confirms suspected consolidation. I'm checking your lungs to check for any pneumonia, anything that's going on in your lung fields. Basically, what I'm auscultating with my stethoscope, you're going to say 99.
Okay.
And an increased sound transmission would suggest consolidation. So can you just sit up for me, please? I'm going to sit to your back. Turn towards me. Oh wait, I gotta listen to your back. Thank you. Say 99.
99.
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 Say again.
99.
Again.
99.
Again.
99.
Again.
99.
Good. Stay just like that. That was normal. I didn't hear any consolidation. Egophony, it confirms suspected consolidation again. When I'm auscultating, you're going to say 8. If there was any abnormal findings, the E that I'm hearing when I'm auscultating would sound like an A. That would mean that you have consolidation. Say E, please.
E.
Say 8.
E.
Again.
E.
Again.
E.
Again.
E.
Again.
E.
One more time.
E.
One more time.
E.
Again.
E.
Good. Now I'm going to check your lung fields bilaterally to make sure they're clear. Take a deep breath. Good. One more. Good. Another one. Good. Another one. Good. Another one. Good. Another one. One more. Again. Good. Lung fields are clear. I'm going to listen to your heart. There should be noted, there should be an S1 and S2 with no murmurs should be present, and there should be no abnormal heart sounds. I'm going to oscillate over the aortic valve, the pulmonic valve, the Erb's point, the tricuspid valve, and the apex. I just need you to move your hands, please. Thank you. Good. Good. S1 and S2 is noted with no abnormal heart sounds or tremors. I'm going to check your, you know, Sean, so I guess I can't check your cap refill, but when we did your pulse ox before, your vital signs was 99 oxygen. Your heart rate was 93 and it was regular. When I checked it, your blood pressure was 108 over 80 and your temperature, like I said before, was 98.4, so no fever.
108 over 80 regular.
Yes, it's normal. I'm going to check the skin turgor. There should be not too much taunt. It should go back right away, which it does. Your hand over, please. Any indentations. Patient does not appear to be dehydrated. The skin is not flaky. The skin is normal. Good hygiene. She's well dressed. Clean, appropriate clothing for her age. I'm going to do a whispered pectoroloquy test. This is the confirmed suspected consolidation like we did before in medicine called Longfield's. You're going to whisper 1, 2, 3, and normal will be producing a high pitched sound, filtered out by lungs, which produces a muffled sound. Abnormal, they would sound louder, clearer sound. A suspected consolidation on auscultation. So I do your lung fields again. I just want you to whisper 1, 2, 3. Oh, can you lift up your hair? Thank you. Okay.
1, 2, 3.
Whisper.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. They were normal. Now I'm going to examine the patient's abdomen for any rebound tenderness. If you don't mind lying flat, supine, please. Just on your back. So I'm going to check for rebound tenderness. So what I'm going to do is I'm going to expose your abdomen. Oh, there we go. Okay. Long day. I'm going to expose your abdomen and I'm going to push on the areas. I know you have Crohn's disease, so I know if you move a little bit. Are you having any issues with that currently right now? Any bloody stools, diarrhea, any sorts of that? It's normal. And if pain is present on the affected side, I would then start on the opposite side, but you don't have any pain currently right now? Okay. So with this, I'm checking for peritonitis or appendicitis. Appendicitis would be in the right lower quadrant. So basically what rebound tenderness is when I push in and when I come off of it, if there was an abnormal, you would jump. So I'm just going to push. If I hurt, just let me know. Any pain? Any pain? Any pain? Any pain? No. Good. There's no rebound tenderness. I'm going to auscultate your bowel sounds. They should be all active in all 4 quadrants. Patient's bowel sounds are active in all 4 quadrants. I'm going to do the obturator sign. So basically what I'm gonna do is I'm gonna flex your knee and your hip at 90 degrees and rotate the thigh internally and outwardly. If there's pain on the right side, which in the right quadrant, which would be your appendix, you may have appendicitis. Moving and we call that because when we're doing that, you have a muscle called the obturator muscle. I can't pronounce it. I butchered it. I know. So, right, you have the pain. Not that one. That's not your right. There we go. So we're going to flex the knee and hip at 90 degrees. I'm going to rotate the thigh inwards and outwards. Do you feel any pressure? No? No? Good? Good. Okay. The patient does not present as negative for any pain. I'm going to now do the Illososa sign, testing for peritoneal inflammation, appendicitis, or inflammation of the iliopsoas muscle. So basically what you're going to do is you're going to recline position, lift the left leg up, and push down on the thigh. If pain is reproduced in the lower quadrant again, if you would have, pain, anything like that, you would have a positive for that. So sit up a little bit. You can come back all the way and lean on the pillow. You're more comfortable. But recline position. There you go. Alright, let's pull the leg up. Any pain when I'm doing this in this area, in the lower quadrant?
No.
Right lower quadrant? No? Okay, good. Patient tested negative for that. So there's not suspected any appendicitis or peritonitis inflammation. Now I'm going to check the Murphy sign. Basically what we're checking for is any acute cholecystitis, which is any inflammation of the gallbladder. So I'm going to lift your shirt up again. You don't have to do that right now. I'm just going to explain what I'm going to do. I'm going to palpate with my hands the gallbladder area, medial to the midclavicular line, which is midclavicular line, it's right here. While you're going to be lying supine, as I'm palpating around, you're going to inhale deeply, which is going to expand the lungs and pushes the gallbladder against the examiner's fingertips, which would be mine. And consider positive if the patient abruptly ceases inhaling due to pain. And even though there might be an absence of this, a positive Murphy sign does not rule out cholecystitis. Shirt down, probably. Right there. Okay. I'm going to be in your gallbladder area. Inhale deeply, please. Any pain? Any sweat? No? No pain? Good. Okay. Patient tested negative for that. I'm going to check your costovertebral tenderness, also known as CVA tenderness. This is going to indicate, this test is for if you have any suspected kidney infections. So the kidneys become infected, and if you thump on the patient, so basically what I'm going to do is in your 12th rib area, there's a little angle on each side. I'm going to have my hand flat, and I'm going to use my, basically as a fist, and hit on my palm, and if you feel any pain, that can suggest kidney infection. Okay, so I need you to sit up. No, like on the edge. You can stand up, it doesn't matter. Okay, I just need to lift your hair the way. Thank you. Turn around, please. Thank you. All right, I'm in the 12th rib area, right here in the angle. Any pain?
No.
Any pain?
No.
Good?
Yeah.
Okay. Does not suspect any kidney infection. We're going to check shifting dullness test, which is bilateral flank dullness, excessive fluid or ascites, any inflammation of your liver. I'm going to start midline and percuss laterally, noting change from tympanic to dull, and mark that line. And then what you're going to happen is you're going to turn towards me and start midline and percuss laterally, and noting a tympanic to dull change. Free fluid present, which when dullness shifts, and then have free fluid in the abdominal cavity. Should be at the same time supine and laterally for negative ascites. So I just need you to lie supine again for me, please. Just lift up your shirt. Okay, and then change. I'm gonna note where it is. And I want you to more towards me. Like that. Good. More. One more. Yeah, there you go. Good. It was negative. So they were at the same time. The dullness and tempiatic were at the same time. Supine and lateral, so it was negative for ascites. So we're gonna check I'm gonna check your Tinel and Phelan test. This is basically checking for carpal tunnel syndrome, which is in here.
Yeah.
So what I'm gonna do, so the Tinel sign, I'm gonna tap over the medial nerves, which all your nerves run in here. I'm gonna go like that, and if you have any numbness or tingling sensations in your digits, your first, second, third, and half of your fourth digit, it'll be positive for carpal tunnel. And the Phelan test, what you're gonna do, you're gonna hold your wrist in a downward motion for like this for 30 seconds, like this, and it's pressing on the nerve. And if you have the same sensations as before, like I said, the numbness or the tingling in your digits 1, 2, 3, and half of 4, then it's positive for carpal tunnel syndrome. So if you don't mind sitting up, please. I'm sorry, it's for 60 seconds, not 30 seconds. So, just look my wrist, yep. Any tingling? Numbness? No? The other hand, please. Thank you. Any tingling or numbness in any of your fingers? No? Okay, good. Now, I need you to have both of them there and hold that for 60 seconds. And 30. That was a minute. Any numbness, tingling in your fingers?
And these two.
And those two?
But all of this one.
Oh, that one? What about the other hand?
No.
No, okay. Patient noted some tingling or numbness.
Numbness.
So some numbness in her digits. Slightly abnormal finding. Now I'm gonna check for scoliosis if you don't mind standing up. Yeah, thank you. I'm just gonna flip your shirt a little bit. If you don't mind bending over just a tad bit. I'm gonna follow her spine down. Should be a natural curve and should be aligned, which it appears to be. Good. Scoliosis is not present. I'm going to do the bulge and bottlement test. The bulge test is used to determine fluid in the knee joint.
Yeah.
So when swelling is not confirmed, you're going to be in supine position. I'm going to extend your knee extended. The indications could be suspected effusion in the knee, inflammation in the knee. If upon palpation there is swelling, redness, heat, or pain. A positive test would be a wave of fluid seen on medial of the knee, down that way. So the knee. I can do that one first. That's fine. Wave of fluid is not seen on the medial knee. The right, now I'm going to do the left. Not present again on the left, so that tested negative. Now I'm going to do the Bollman test. So I'm going to push down under patella, which is a part of your knee, or your kneecap. A positive sign would be if the patella floats or bounces back after tapping, and positive test indicates significant joint infusion, which would be fluid in the knee cavity. Okay. Good. Negative. Good. That's negative. Okay, now I'm going to do a straight leg raise test. It's used to diagnose discogenic or radicular lumbar pain. What's going to happen is I'm going to lift your leg while keeping these straight from the ankle. No symptoms should be present. Test is positive if significant back pain or radicular pain in the lower extremity is present. A positive test may also indicate sciatic or lumbosacral nerve root irritation, for example, due to prolapsed lumbar disc. Leg straight. Any pain in the lower area? No? Good. Next one. Any pain? No? Okay. Patient tested negative. So there was a normal finding and no symptoms were detected. We're going to do a Romberg test, which is a balance test, joint position, sense, and vestibular function without aid from visual input. So you're going to stand up. Feet together, arms out in front. Close your eyes. I'm going to be nearby. A positive becomes if you unsteady or fall, indicating joint position stance. Alright, good. Not too bad. Tested her balance and joint position sense was good, and had vestibular function without aid. Now I'm going to do kinesthesia test. So you're going to position the patient in the supine with their eyes closed, and secure their arms by holding joints, and move the patient's tested arm, and have them follow along by mirroring the movements with their other arm. So basically what's going to happen, this arm down, right? As I'm moving this arm, I want you to do it with the opposite arm, okay? Same direction. I'm done. Okay. I'm testing the shoulder joint movement right now. Good. Patient is synchronized. Now I'm going to check your wrist. Do the same thing when I'm done. Good. So normal, which it was, you can follow along with what I was doing. Stereogenosis. Basically, it's the ability to identify objects that are placed in the hand when the eyes are closed. And the inability to do this would indicates parietal lobe dysfunction. So I'm just going to grab a few things. Whoops. Close your eyes, please. Bring your hand flat. No. Yeah, there we go. What is it?
Scissors?
Yes. And you need to make sure you didn't open them.
Good.
What's this?
A pen?
Correct. What's this?
Glasses?
Correct. Yeah. No parietal lobe dysfunction. Now I'm going to do graphesthesia, ability of the patient to identify characters that are written on the skin using a dull pointed object. This is going to be done while the eyes are closed. Test indicates parietal lobe function, and abnormal would be dysfunction of the parietal lobe. So I'm going to use this, close your eyes, and I'm going to draw numbers on and just tell me what the number is.
8.
Correct.
7.
Correct.
3.
Good. Okay, now I need you to stand up, please. I'm just checking, push on my hands. This is good. Steady. I'm just checking your. Hold it straight and your fingers down. Good. I'm gonna check the other arm. Good. I'm gonna check your pulses. I need to check your. First, I'm gonna check your. Make sure there's no jugular vein distension, which there should not be. Good. There's a range extension. I'm gonna check for pulse. Pulse is noted. Did you have some type of infection on your ear?
Yeah.
Or are you still? Did you finish the antibiotics?
No.
No. You finished the antibiotics.
Well, I have to go back to the doctor because
Okay.
it didn't go away.
Okay. All right. We'll talk about when the physician comes in. We'll talk about it. I'm just orchestrating. Just checking your pulses. It's okay. Hold on, please. Yeah. Pulse is 2 positive with bounding strength. I'm gonna checking your pulses in your feet. Dorsopedialis. Good. Good. Another one, please. Good. Do you have any questions for me at all?
No, I'm okay.
You're good?
Yep, I understand.
Okay, the doctor will be in shortly to see you.
Okay.
Have a great rest of the day. If
You
any
too.
questions, let me know.
Alright, it was nice to meet you.
You as well, Skylar.